There's going to have to be a reform of American healthcare one way or the other. The problems in American healthcare really stem from the fact that the marketplace doesn't function properly, and that is really related to existing governmental policy. The government has gotten very involved in healthcare. People say, well, we have a private market today. We actually don't really have much of a private market today. What we have is poorly designed governmental policy distorting what would have been a properly functioning marketplace. That begins with the fact that the federal government subsidizes health insurance through three platforms. It subsidizes employer-based health insurance, it subsidizes Medicare, and it subsidizes Medicaid. That's where the vast majority of Americans get their health insurance, and in all those instances, the federal government subsidy grows with the expense of the plan. So the more the plan costs, the more the government subsidizes the insurance. That's exactly the wrong kind of incentive. So the primary thing we have to do to move away from that is change governmental policy toward what I call a defined contribution approach to healthcare. That is, instead of open-ended governmental commitments to insurance as an entitlement through those three platforms, the government would say to the people participating in those programs, look, we're going to give you good coverage for your insurance. You're going to get a good amount of subsidy from the federal government to buy the kind of insurance you need, but it's not going to be open-ended. It's going to be fixed and defined. If you buy a more expensive plan, you'll have to pay the additional amount out of your own pocket. If you, however, economize and buy a less expensive, more efficient plan, you actually will save some premium and keep that money in your own pocket. So that's the number one thing that needs to happen. You need to have cost-conscious consumers participating in the marketplace. The federal government needs to make that happen through changes in governmental policy.